This is Dr. David Chao again. Once again, I'm an orthopedic surgeon, sports medicine specialist in San Diego. And by way of background, I've had some familiarity with KAATSU for over a decade. And once it became these pressurized band models, which is what I've been lobbying for, I've been an enthusiastic user. In the other video, we talked about why I thought it was safe in general. But this is why I think the KAATSU bands and what's unique about it. It looks like a tourniquet, but it's much thinner than a tourniquet, and it is safer than a tourniquet. Because a tourniquet or a blood pressure cuff that's usually, this wide, actually will occlude arterial flow. This will not occlude arterial flow, no matter what pressure you have in it. First of all, the air bladder here is even thinner than the band. And anytime you have pressure, if the blood pressure cuff is as wide as my hand, the pressure effects cone down the deeper you are, which is why you need a wider cuff for thigh cuffs than for arm cuffs. There's a cone down effect. So if you start with the band this thin, the cone down effect happens much more quickly. Therefore, it never gets down to the arterial level, and your arteries, whether you're in your thigh or your arm, are always next to the bone. So it has to be fairly deep. So with the surrounding musculature, you're never going to cut off arterial flow with this thinner band. We talked about how tourniquets can be safe, where you can put on the wider tourniquets and occlude the artery for up to 2 hours in surgery. This will never actually occlude the artery. We're not saying you should use this infinitely or greater than 2 hours. You're going to use these in short spurts anyways, 15 minutes at most. But this is why these thin bands, custom made for KAATSU, make sense. The thin bladder is purposeful. For those that worry about nerve injury because the band's thinner, when you see this and feel this, you see there is no sharp edge. It's not a rope tying around, cutting into your skin or muscles. The only complications I've ever seen is that sometimes you'll pinch some skin or get a little bit of superficial bruising for a novice user. Usually you put it on top of your t-shirt sleeve, and it's not a big deal at all. There have been no nerve or artery issues whatsoever because of the thin design. And I'll show you and prove to you how it doesn't cut off circulation. I'll put on just on my right arm here the KAATSU band. And also the thin band, as you can see, as you flex, if you have the thicker band, your muscles change the pressure and the contraction anyways. So I have this set up here, and we'll do a quick check. And a pressure of about 30 is about right, so 28, close enough for demonstration purposes. And I have set this at 300. I'm only doing the right side just for demonstration purposes. And 300 is not what you want to start with. I've built up to that over time. But with 300, if the lighting is good, you can see in the palm of my hand that it's still red and beefy, but there is good return of flow of fluid. But let's do this for a example. On my left hand, the pulse ox reading is going to be 95 and 96% oxygenation, pulse is 76. Obviously I need to work out more. On the right, obviously this is going to be normal because I just put this on, and it's not even inflated, so it's the same. So 96, 97, and 75. So if we start KAATSU training now, and you can hear the thing, and with this, just as a quick demonstration, this is at 25 pounds curling. And if I start doing 25-pound curls in this, and I'm right-handed, by the way. I mean, I'm able to do it, but you can see how I'm starting to fatigue out doing that. And if we just put on the pulse ox, I'm getting a pretty good burn right there. Let me turn that on again. And it's still going to be the same. Obviously my pulse is up a little bit. and we'll come back to that. I'll leave this on, and you can see, if you can see the venous engorgement in my arms as a result of it, the pump. And just for demonstration purposes, here's 25-pound curls on my left non-dominant arm. And I can just kind of keep going pretty easily with that. And this is my weaker arm anyways. And I can do the rest of my talk with you guys and keep doing these 25-pound curls. But on this side, I really wouldn't be able to do it. It starts to get pretty heavy over time. But I'll do it a little more here, and I'll show you once again the pulse ox reading does not change. And remember, this is set at 300, which is pretty high. I feel a burn in my arm for sure, but the pulse ox, I promise you, I've put this on continuously, even on my thighs. Sorry, I'm a little out of breath, but the pulse ox doesn't change. And the fact that you can still detect my pulse, which is now at 93, 92, means that there's still a reading, which means blood flow is still getting in, because you can't detect the pulse otherwise without it. So the venous engorgement and the expanding of the blood flow system is part of the secret of Katsu. But you can see it's actually not a tourniquet at all. And you can see the fatigue nature, and that's why the thin band is important, because as the thin band cones down in terms of the pressure, it doesn't get all the way down to the bone and the artery. But you can see the engorgement, that the lighting is good as a result of, compared to this side, which I'm fairly dehydrated here this morning, but there you go. Okay?